If you've tested positive and you live with other people, then obviously you need to be doing things to keep them safe. If you do test positive, the most important thing is to not panic, just relax, just remember that COVID-19 in the vast majority of people is a mild to moderate illness. If you are sick, obviously you'll be isolated at home. Public health will be contacting you every day to check on your health, and that's about it. There's not much else that you'll need to do apart from follow all the isolation guidelines. You do need to tell people, obviously, that you've got the COVID-19 illness, especially people that you might work for. If you're living in the colleges, your dean or the head of the college. Remember that public health will contact you and they will go through a lot of questions about where you've been, who you've contacted. They'll help you work all that out, and then they'll go ahead and do the contact tracing for you. If you've tested positive and you live with other people, then obviously you need to be doing things to keep them safe. The first thing to say though is that public health will be involved and they will give you very detailed instructions as to what you need to do. But the main things will be keeping away from people, keeping distanced, and also making sure that you wear a mask. Bathroom facilities are going to be really important, so if it's possible, you'll have your own bathroom facilities, or if they're shared, they'll be cleaned really thoroughly and you'll use them last. And people will have to go out and get grocery items for you, etc. So if you've got COVID-19 and you're isolating at home and you start to feel like you're getting worse, maybe you're coughing a lot more or your fever's persisting, maybe you're not breathing very well, remember you'll be being monitored by public health on a daily basis. So they will be asking you questions, checking on what your symptoms are, and if you start to deteriorate to a point of concern, they'll call an ambulance and get you into hospital straight away. If you're isolating at home with a mild to moderate COVID-19 infection, you can come out of isolation 10 days after the first day of your illness, providing that you're symptom-free for 3 days before then. Otherwise, it will be a 2-week period for you to come out of isolation.